Hello everyone and welcome to another session of Facebook Live. Today's session will be on rectal cancer, and to discuss this we have with us Dr. Vinitha Reddy, Senior Consultant Radiation Oncologist, American Oncology Institute of Hyderabad. Good evening, Doctor.
Good evening.
Coming to the questions, what is rectal cancer and how common is it in its incidence?
Okay, so rectum is actually the lowermost part of the intestine, large intestine is the rectum. Where rectum is a place where when we eat the food and it gets digested, the part which has to be expelled out, it is stored in the rectum, and then it comes out through the anus. So the cancers that occur in the rectum are called rectal cancers. Usually the part of the intestine that is above the rectum is called colon. So usually colon and rectum cancers are clubbed together and called colorectal cancers. But definitely the colon cancers and rectal cancers, the management is different. So we'll just talk about rectal cancers.
Second question, what are the causes of rectal cancer?
Any cancer is caused by genetic changes or mutations, sudden changes in any DNA of the cell, which causes tumor formation and then cancer. So same wise, rectal cancer is also caused by some genetic mutations, which may sometimes happen in the same individual suddenly, or it may be inherited from parents to children. So those are called hereditary mutations, or de novo in the same person also they can just arise as mutations. This usually is causes rectal cancer. So more than causes, there are certain risk factors that are attributable to rectal cancer. So suppose an individual eats more of processed food and less of vegetables or less of fiber food, those individuals are at risk of developing rectal cancer. And obesity and less of physical activity. So if an individual has, good physical activity or does proper exercise, so those people are at low risk of developing rectal cancer. So decreased physical activity leads to high risk of rectal cancer, developing rectal cancer. And so obesity, alcoholism, smoking, these are all attributable factors to rectal cancer. So more than that, there are certain syndromes or hereditary non-polyposis colon cancer, like it's called Lynch syndrome, or familial adenomatous polyposis. The individual has multiple polyps in the intestine. So those people are at increased risk of developing rectal cancer.
Question, madam. Who is at risk for developing rectal cancer?
So as I have mentioned now, so certain individuals are at increased risk. So we can't say these are the causes for rectal cancer, but certain individuals are at increased risk of developing rectal cancer. So as I've mentioned earlier, so people who are used to eating more of processed food, less of fiber and less of fruits and vegetables, and people who eat red meat, and less of physical activity or exercise, and alcoholism, smoking, and people who have such syndromes called Lynch syndrome and polyposis, multiple polyps. So these are at increased risk. And some conditions called ulcerative colitis and Crohn's disease, these individuals are also at risk of developing rectal cancer.
Fourth question, madam. How is rectal cancer diagnosed?
Okay. So before I talk about the diagnosis of rectal cancer, we'll just talk about the symptoms of rectal cancer. So normally we have fixed bowel pattern, like every day the person passes motion, and that's called normal or regular bowel pattern. Sometimes the bowel patterns get disturbed, altered bowel habits, like too much of loose motions or constipation, alternating like constipation and diarrhea. So such things should alert us or should give an alarming sign that it might be those are the causes of the symptoms of rectal cancer. Sometimes the blood in the motion, when the person passes motion, he notices some blood. So that may be one symptom of rectal cancer. And sometimes loss of weight, loss of appetite, those are all the maybe late symptoms of rectal cancer. So the diagnosis of rectal cancer, so when an individual has all these symptoms, when they consult the doctor, they do a colonoscopy, And then if there is any ulcer, they take a biopsy from that, and that's how we diagnose rectal cancer.
What are the treatment options available for patients diagnosed with rectal cancer?
The treatment options for people diagnosed with rectal cancer are surgery, radiation therapy, and chemotherapy. So for any cancer, of course, these are the treatment modalities available. Same wise for rectal cancer. Previously, they used to do surgery. Surgery was the first option for rectal cancer, which was followed by radiation therapy and chemotherapy. But nowadays, we are giving radiation therapy first, and then we assess the disease after 8 weeks, 6 to 8 weeks after radiation therapy, so that the tumor size comes down, and then it is easy to operate. So radiation therapy followed by surgery, and then if necessary, chemotherapy. These are the treatment options available for rectal cancer. So we also have targeted therapy injections, which also might be necessary maybe in the late stages as per the medical oncologist opinion.
Is it safe to undergo surgery in the case of rectal cancer?
Yes, definitely it is safe to undergo surgery, because surgery is one of the main modality of treatment for rectal cancer, and it is safe to undergo surgery. There is no risk involved with surgery.
Great question, doctor. Can rectal cancer be prevented?
Yeah. So rectal cancer, we can, maybe we cannot prevent rectal cancer, but we can decrease the risk of getting rectal cancer because there are certain risk factors that I have mentioned already. So by following a healthy lifestyle, basically, by eating nutritious food, not eating too much of red meat and processed food, and having regular exercise, regular physical activity is most important, so that you should be able to pass motion daily. That's so you are there should not be any storage like constipation. Those problems will increase the risk of rectal cancer. So by doing all this, by following a healthy lifestyle, we can prevent reduce the risk of getting rectal cancer. And there are certain genetic tests that might predict that that an individual might get these these cancers. So maybe by getting this genetic test done, we will be able to prevent some certain cancers, and same wise rectal cancer. And also, if the individual, if there is a family history of rectal cancer, the individual can undergo certain colonoscopy, certain tests, and then maybe prevent rectal cancers.
Last question, doctor. Is there any chance of recurrence of rectal cancer? And what are the signs of recurrence and recovering from rectal cancer?
Yeah, definitely. The rectal cancer also might recur as in any other cancers, even after treatment, even after proper treatment and getting cured. Also, the chances that the disease might come back are also there. And the signs of rectal cancer recurrence depends upon where the disease has come back. If it is in the same place, like in the rectum, the patient may have pain, bleeding in the during motion, as I have mentioned earlier, and pain is most common. And if it comes in a different place, like in lungs or liver, the patient might complain of breathlessness and cough. And if it is in liver, loss of appetite and weight. So it depends upon where it comes back. So definitely, but there are chances that the rectal cancer can recur. And the treatment options are also depend upon where the disease comes back. So we might advise surgery again, or radiation therapy, chemotherapy. This all depends upon what treatment the patient has taken earlier, and what is the duration after which the treatment, the disease is coming back. That's most important. So how many years later it is coming back, and what are the treatment options available now. So based on that, we advise the treatment for recurrence.
So with this, we conclude this session of Facebook Live. We will be back next week with another episode. Thank you.
Thank you.